Have you ever paused to wonder how aging truly affects your sexual health, and specifically, how something as natural as masturbation fits into life when you're in your 70s or 80s? It's a question many people carry silently, often afraid to speak out loud. Society tends to celebrate youth, beauty, and sexuality when we're younger, but the conversation almost disappears as we grow older. This silence creates confusion, guilt, and sometimes even shame. Yet, the truth is simple. Sexuality does not have an expiration date. Desire, pleasure, and intimacy, whether with a partner or with yourself, can remain part of your life story for as long as you live. Unfortunately, for too many seniors, this topic is buried under years of stigma. Perhaps you've been told, "That's inappropriate at your age." Or maybe you've heard whispers that sexual desire after 70 is strange or even unhealthy. But here's the reality. Doctors, psychologists, and researchers all agree. Sexual expression, including masturbation, is a normal and healthy part of aging. What changes is how our bodies respond, what our emotions feel like, and how we can adapt. And that's exactly why this video matters. Because if you're 70, 75, 80, or even older, you deserve the truth. You deserve to understand what really happens to your body, your hormones, your emotions, and your health when it comes to self-pleasure. Over the next several minutes, we'll explore 8 essential insights that every older adult should know about masturbation. Some of these points may surprise you, some may reassure you, and others may give you the courage to embrace this part of life without fear or embarrassment. We'll talk about the natural physical changes that come with age, the potential health risks you should be mindful of, the benefits that often go ignored, and the emotional freedom that comes with breaking old taboos. This isn't about judgment. This isn't about shame. This is about truth, dignity, and your right to live a life that still includes pleasure, intimacy, and self-understanding, even in your later years. So if you believe that older adults deserve honest conversations about aging and sexuality, conversations free from stigma and full of compassion, I invite you to support this channel. Before we begin, please take a moment to like this video. It may seem small, but it tells YouTube that these conversations matter, and it helps other people just like you discover this information. If you haven't already, hit the subscribe button and turn on the notification bell, so you'll never miss future videos designed to help older adults live not just longer, but happier, freer, and more comfortably. And as we go along, I'd love to hear from you in the comments. If you find this topic important, type the number 1 below to let me know you're watching and engaged. If you think we can do better, type 0. Your feedback helps shape every video we create. Now let's dive into today's discussion. Doctor's warning: if you're 70 or 80 and still masturbate, here are 8 things you must know. As we move into our 70s and 80s, one of the most profound influences on our sexual health, and specifically on how we experience masturbation, is the physical transformation that naturally comes with aging. These changes are not sudden. They don't happen overnight. Instead, they unfold gradually over decades, often so slowly that you only notice them when you pause to compare how your body responds today versus 20, 30, or 40 years ago. Hormonal shifts. For men, testosterone plays a central role in sexual desire, energy, and erectile function. But starting as early as the late 30s or 40s, testosterone begins to decline, about 1% every year. By the time a man reaches 70 or 80, he may have half or even less of the testosterone levels he once had in his youth. This gradual decrease explains why some older men notice that sexual thoughts don't come as often, arousal takes longer, or erections are more difficult to achieve and sustain. According to studies published in Maturitas and supported by Kaiser Permanente research, these shifts are completely normal, but they can feel frustrating, especially for men who grew up believing that sexual desire should remain constant throughout life. For women, the hormonal landscape changes differently but just as dramatically. Menopause, typically arriving between ages 45 and 55, marks a steep decline in estrogen and progesterone. By the time a woman is 70 or 80, these hormones are significantly lower, and their absence affects every part of sexual function. Estrogen is vital for maintaining vaginal health, keeping tissues elastic, blood flow strong, and natural lubrication consistent. Without it, many women experience vaginal dryness, thinning of the walls, and even discomfort or pain during stimulation. Some also report reduced clitoral sensitivity, meaning it may take longer or require different kinds of touch to achieve arousal. These changes are not a sign of something broken. They are simply the body adjusting to a new stage of life. Blood flow and circulation. Another critical piece of the puzzle is circulation. Healthy sexual arousal relies heavily on blood flow. Erections in men and swelling of vaginal tissues in women both depend on increased circulation to the genital region. But with age, arteries may narrow, circulation may slow, and conditions like high blood pressure or diabetes can further reduce blood flow. Harvard Health notes that older men may find erections are less firm, take longer to develop, and may not last as long. For women, reduced blood flow can make arousal feel less intense, and lubrication may not arrive as quickly without stimulation. The tissues themselves also change over time. For women, declining estrogen leads to thinner, less elastic vaginal walls, a condition known as vaginal atrophy. Without lubrication or the use of moisturizers, masturbation may feel uncomfortable or even painful. That's why many doctors encourage women in their 70s and 80s to use water-based or silicone-based lubricants, which can restore comfort and even make the experience more pleasurable than it was in earlier years. For men, reduced elasticity and circulation affect erectile firmness, sometimes creating performance anxiety even during solo activity. This can lead to shorter or less intense erections, but with patience and adjustments, pleasure is still very possible. Sensitivity and nerve function. Finally, we must talk about sensitivity. Nerves age just like any other part of the body. Conditions such as diabetes, neuropathy, or even long-term medication use can reduce genital sensitivity. What once took only a few minutes to achieve might now take much longer. The intensity of orgasm may also be different, sometimes less powerful, sometimes shorter, and occasionally absent altogether. But here's something important. Many older adults discover that slowing down, experimenting with new techniques, or shifting focus to the entire body, not just the genitals, can unlock new layers of pleasure they never experienced before. Psychological impact. All these changes, hormonal, circulatory, tissue-based, and neurological, can have a psychological effect as well. Some older adults feel anxious, frustrated, or embarrassed when they notice their bodies don't respond like they used to. That anxiety can actually make sexual challenges worse, creating a cycle of worry and disappointment. But the key is perspective. These changes are natural, expected, and shared by millions of people your age. They are not a reflection of your worth, your masculinity, or your femininity. With the right knowledge, tools, and patience, sexual pleasure, including masturbation, can remain an enjoyable and affirming part of life well into your 70s, 80s, and beyond. As we age, the conversation around masturbation, or any form of sexual activity, can no longer be separated from the reality of our overall health. In our 70s and 80s, chronic conditions, medications, and physical limitations become part of daily life. These factors don't necessarily mean you must stop enjoying sexual pleasure, but they do mean you should approach it with awareness, gentleness, and sometimes even medical guidance. Chronic illnesses and their impact. Diabetes. Diabetes is one of the most common conditions in older adults, and it can have a direct effect on sexual health. High blood sugar over time damages nerves and blood vessels. For men, this often means erectile dysfunction or delayed ejaculation. For women, it can reduce natural lubrication and decrease sensitivity in the genital area. Some people describe it as feeling numbness, where there used to be sensitivity. While frustrating, this doesn't mean sexual pleasure is gone forever. With patience, different techniques, or the use of lubricants and vibrators, many people with diabetes still find satisfaction. Cardiovascular disease, heart disease, high blood pressure, and a history of strokes or heart attacks are major considerations. Sexual arousal naturally increases heart rate and blood pressure. For a younger body, that's rarely a problem, but in an older adult with cardiovascular disease, that extra exertion can trigger symptoms like chest pain, dizziness, or shortness of breath. Doctors often compare sex to mild to moderate exercise. If you're cleared for light physical activity, masturbation is usually safe. But if you experience any concerning symptoms, such as palpitations or pain, stop and talk to your healthcare provider. Remember, your safety comes first. Arthritis and joint problems. Arthritis doesn't just affect walking, climbing stairs, or opening jars. It can also affect sexual activity. Repetitive movements of the hand or wrist, or certain body positions, may trigger pain or stiffness. Many older adults find relief by using supportive cushions, changing positions, or slowing down. Masturbation doesn't need to be physically demanding. Sometimes a gentler, slower approach not only reduces strain but actually enhances pleasure. The role of medications. By age 70 or 80, many adults are on one or more prescription medications. These drugs may save lives, but they can also interfere with sexual desire and function. Blood pressure medications. Some reduce blood flow, making erections less firm or arousal less intense. Antidepressants. SSRIs. These can delay orgasm or make it harder to achieve climax. Diabetes medications can sometimes affect nerve sensitivity. Hormone treatments. For women, lack of hormone replacement therapy after menopause may worsen dryness. For men, low testosterone treatments may boost libido, but not always sensitivity. What's important is that these side effects are not something you need to silently accept. Doctors often adjust doses or recommend alternatives. For example, some people find that changing the time of day they take a medication improves sexual function. The key is to communicate openly. Remember, doctors are trained to handle these questions, even if it feels awkward to bring up. Overexertion and fatigue. Masturbation may not seem like strenuous exercise, but it does elevate heart rate, breathing, and muscle activity. For some older adults, especially those with heart conditions or chronic fatigue, it can feel draining or uncomfortable. The key is pacing yourself. Choose times of day when you feel most rested. Experiment with slower, more mindful stimulation instead of forceful or rushed activity. Think of it as treating your body with care rather than demanding performance from it. Risk of injury or irritation. The skin and tissues also become more delicate with age. Reduced elasticity and natural lubrication increase the risk of small tears, irritation, or chafing. Especially if you're using the same techniques that worked in your 20s or 30s. Here's where lubrication becomes not just helpful but essential. For women, vaginal moisturizers or lubricants reduce dryness and protect delicate tissues. For men, lubricants can prevent friction that might otherwise irritate thinner skin. Using creams, oils if safe, or water-based lubricants can make the experience smoother, safer, and far more pleasurable. Remember, gentleness is the golden rule. Psychological layer. It's also important to acknowledge how these health risks can affect the mind. For example, A man with heart disease may fear that masturbation could trigger something bad. A woman with arthritis may feel frustrated that her body no longer cooperates. These worries can spiral into avoidance, shame, or guilt. But knowledge is power. Understanding what your body can safely handle removes fear and restores confidence. Instead of thinking, "What if something goes wrong?" you can focus on, "How can I make this safe and enjoyable?" Bottom line, health conditions and medical risks do not mean your sexual life is over. They just mean it looks a little different now. Adjustments may be necessary. Softer touch, more lubrication, new positions, or talking to your doctor about medications. But with awareness and care, masturbation can remain safe, satisfying, and life-enhancing well into your later years. When it comes to masturbation after 70, one of the most common questions is, how often should I be doing this? What's normal for my age? The short answer is, there isn't a single normal. Every body, every relationship, and every season of life is different. But science, medical research, and the experiences of older adults give us helpful perspective. What research shows about frequency? Multiple studies have looked at sexual behavior across the lifespan. A large study published in the Journal of Gerontology found that while sexual activity, including masturbation, does decline with age, it never disappears entirely. Among men in their 70s, about 40 to 50% report continuing to masturbate. Among women, the percentage is lower, around 25–30%, but still significant. Even in their 80s and 90s, some adults report self-pleasure as an important part of their emotional and physical well-being. Harvard Health notes that age does not eliminate desire. It simply reshapes it. Desire may come less often, require more time, or feel different than in younger years, but it rarely vanishes altogether. So if you're in your 70s or 80s and still feel sexual urges, you are not unusual. And if you don't feel them as much, you're not broken. You're simply on your body's natural rhythm. The myth of right frequency. When people are younger, especially in their teens and 20s, there's often a cultural obsession with how often someone should masturbate. Some even carry guilt if they believe they're doing it too much or not enough. But after 70, the rules change. Doctors emphasize there is no medically prescribed number of times per week, month, or year that makes masturbation healthy or unhealthy. The right frequency is as often as you enjoy it, as often as your body feels comfortable, as often as it adds to your well-being. For some, that might mean once a week. For others, once a month. And for some, it may be daily or several times a week. What matters is that it feels satisfying, safe, and aligned with your energy and health. Adjusting expectations. One of the biggest shifts with age is not whether you can enjoy masturbation, but how you experience it. Slower arousal. Where arousal may have been quick and automatic in your 20s, in your 70s or 80s it may take longer. The body simply responds more slowly. For men, erections may take time to build and may not be as firm. For women, lubrication may not arrive automatically. This isn't dysfunction, it's biology. Longer time for orgasm. Many older adults report that orgasm takes longer to achieve. This can feel frustrating at first, but many also discover that the extended buildup creates deeper relaxation and even more satisfaction when climax finally comes. Different techniques. What worked before may not work now. Some men find gentler touch or using lubricant more effective. Some women discover that external stimulation with fingers or devices brings more pleasure than internal methods. Exploring instead of comparing to the past opens new doors. Orgasms that feel different. Some report that orgasms feel less intense than in youth, while others describe them as more emotional, more full body, or more soothing. The key is not to judge the experience against your 20-year-old self, but to welcome what your 70 or 80-year-old body offers. Breaking free from comparison. A trap many fall into is comparing themselves with either their younger self. I used to be able to do this 3 times a day. Now I'm lucky if it's once a week. Or with others. My friend says he still has sex twice a week. What's wrong with me? The truth. Sexual health at this stage is not about competition. It's about comfort, joy, and connection with yourself or with a partner. Just as some people enjoy walking daily while others garden or paint, sexual frequency has no universal standard. Signs it's becoming unhealthy. While there's no too much in terms of numbers, there are a few red flags to watch for. If masturbation leaves you consistently exhausted or in pain, if it becomes compulsive, interfering with sleep, social life, or responsibilities, if it stirs guilt, shame, or worsens loneliness instead of improving mood. If any of these happen, it's a signal to step back, reflect, and possibly speak to a doctor or therapist. The psychological side of frequency. It's also worth remembering that sexual desire is not just physical. It's mental and emotional. Sometimes masturbation is about pleasure. Other times it's about comfort, stress relief, or simply affirming that you're still alive and connected to your body. That's why frequency may ebb and flow depending on your mental state, mood, or life situation. For instance, after the loss of a spouse, some find masturbation helps ease grief and loneliness. During periods of stress, others find it relieves tension and helps them sleep. And sometimes, people go through months without it, then rediscover the joy unexpectedly. All of this is normal. The bottom line: there is no stopwatch, no chart, and no rulebook that dictates how often a 70 or 80-year-old should masturbate. What's normal is whatever brings you peace, pleasure, and health, without harm or guilt. Think of it less as frequency and more as quality. Whether once a week, once a month, or more often, what matters most is that it enriches your life rather than diminishes it. As open and natural as masturbation is, even in your 70s, 80s, and beyond, there are moments when listening to your body means recognizing that something isn't quite right. Many older adults hesitate to bring up sexual health concerns with their doctors. Some worry about embarrassment, others believe it's just part of aging. Nothing can be done. But the truth is, there are many situations where seeking help is not only wise but can make all the difference in your comfort, safety, and long-term health. Let's walk through the signs that should not be ignored. Point 1. Persistent pain or discomfort. Occasional mild discomfort, such as temporary dryness or mild muscle fatigue, may happen, especially as circulation slows or tissues become more sensitive with age. But certain warning signs should prompt you to consult a healthcare provider. Burning, stinging, or sharp pain during or after masturbation. Unexplained irritation, rashes, or redness that doesn't heal quickly. Bleeding, tearing, or sores, particularly in the genital area. For women, thinning of the vaginal walls, atrophic vaginitis. After menopause can cause microtears if lubrication isn't used. For men, repeated pain in the penis, testes, or pelvic area may signal something more serious, such as prostatitis or circulatory issues. Bottom line: if pain is consistent, don't just push through it or assume it's normal for my age. Pain is the body's way of asking for attention. 2 changes linked to medications. As we age, medications often become a bigger part of daily life: blood pressure pills, antidepressants, diabetes treatments, cholesterol-lowering drugs, or arthritis medications. Many of these can affect libido, desire, arousal, erection or lubrication, sensation, numbness, reduced pleasure or delayed orgasm, stamina, fatigue, weakness. If you notice a clear change that seems tied to when you started or increased a medication, Don't assume you're stuck with it. Doctors can often adjust the dosage, switch you to a different medication, suggest therapies to offset side effects. You don't have to suffer in silence. Sexual side effects are one of the most underreported, but most treatable problems in older adults. 3. Emotional strain, shame, guilt, or anxiety. Sexuality is never just physical. It's deeply tied to our mental and emotional well-being. And while masturbation can bring stress relief, comfort, and pleasure, for some it triggers the opposite. Feelings of guilt, often due to cultural or religious teachings from youth. Anxiety, such as worrying, is this normal at my age? Loneliness, where the act brings sadness instead of comfort. If you notice these patterns, know this: you are not alone. Many older adults struggle with the emotional side of sexuality in silence. Speaking with a therapist, counselor, or sex therapist can normalize your experience and help you rebuild a healthy, shame-free relationship with your body. Even joining a support group for older adults discussing intimacy can remove the isolation and bring comfort in knowing others share the same journey. 4. Underlying health concerns. Sometimes masturbation can act as a window into your broader health. Because it involves circulation, hormones, and energy, changes in your sexual response may reveal hidden medical issues. Seek help if you notice shortness of breath, chest tightness, or rapid heart rate during arousal or orgasm. This may signal cardiovascular issues that require clearance from a doctor before continuing. Sudden loss of sensitivity or inability to achieve orgasm. This can sometimes be linked to nerve damage from conditions like diabetes or neurological diseases. Severe fatigue or dizziness connected to sexual activity, which may point to blood pressure, heart, or medication-related issues. It's better to be cautious. Doctors are trained to take these symptoms seriously, and early intervention often leads to better outcomes. 5. When normal aging isn't the whole story. Yes, aging naturally changes sexual response, but not every difficulty is simply old age. Sometimes what you assume is a natural decline could be hormonal imbalances, low testosterone, thyroid issues, estrogen deficiency, circulatory problems, early vascular disease, prostate problems in men, or pelvic floor issues in women. A simple medical checkup can reveal whether the challenges you're facing are part of healthy aging or signs of something treatable. 6. The courage to ask. Many seniors feel hesitant to bring up sexual health with their doctors, worrying the conversation will be awkward. But remember, physicians, nurse practitioners, and therapists have heard it all before. To them, your concerns are valid medical issues just like joint pain or blood pressure. A good way to start is with a simple sentence: I've noticed some changes in my sexual health, and I'd like to talk about it. This medication seems to affect my libido. Can we review alternatives? These openers shift the discussion into a health-focused space, making it easier to address openly. The bottom line: masturbation at 70, 80, or beyond is not only normal, it can be beneficial. But pain, distress, or unusual changes should never be ignored. Whether it's physical discomfort, medication side effects, emotional struggles, or signs of broader health issues, reaching out for help is a sign of wisdom, not weakness. Your sexual health is part of your overall health. By speaking up and seeking support when needed, you ensure that this part of life remains safe, satisfying, and dignified. As we close this conversation, let's pause for a moment and reflect on what we've learned together. Aging is a remarkable journey. It reshapes our bodies, our minds, and yes, our sexuality. Hormones shift, circulation slows, sensitivity changes, and sometimes our responses are not as fast or as intense as they once were. But here's the truth: None of these changes erase the deep human capacity for pleasure, intimacy, or self-connection. Masturbation, even in your 70s or 80s, remains a natural, healthy, and meaningful expression of sexuality. It's not something to feel ashamed of. It's not something to hide from. Instead, it can be a gentle way to care for your body, release stress, reconnect with yourself, and remind you that pleasure has no expiration date. Of course, aging also means being mindful, understanding that our bodies may require different techniques, more patience, or supportive tools like lubrication. It means listening carefully to your body, noticing if there's pain, irritation, or changes that might require medical advice. It means accepting that slowing down doesn't mean stopping. It simply means adjusting.